The most rewarding part, I would say, about practicing is the education part. I think that a lot of times that gets overlooked in healthcare, and so that if I can educate my patients about why it's important that we're doing what we're doing, how to, maintain a healthy lifestyle, what contraceptive choices are the best for them, how to help with any abnormal bleeding, how to help with pregnancy. I love being able to educate. I feel like that's the biggest part of what I do most days. When I'm not at work, I have a varied interest. I enjoy hanging out with my family. I've got 2 young children, and so we're constantly going into St. Louis and doing the zoo and the botanical gardens, and Grant's Farm is another favorite of ours. I think being a mom has kind of changed my perspective on obstetrics mainly, of course, because having gone through it personally, I always kind of have my personal take on it, but then remind myself that everybody's experience is going to be different. And so it's just nice to kind of have that shared interest and shared venture that you're going through it together. And then I can always kind of tell where they're coming from and empathize with what they're going through. I like working out here at the Sullivan Hospital because I like the community feel. I feel like I'm a big part of the community. I did residency in a large area and I felt like one of many, and so out here it's kind of nice to feel like I'm needed and that I'm helping to make a difference in the community. When my patients come to deliver here at Sullivan, it's a very intimate experience in the sense that, we've got a small staff, we've got nice big rooms in which to deliver, so you can have a lot of family and friends with you during the laboring process. And so that's nice for them to have that. I think that it's nice too that we have a wonderful nursing staff that's very educated, not only with the delivery process, but then after the baby comes with lactation support. And that's been a big bonus, I feel like, for my patients. At the hospital, the technology is state-of-the-art. We're keeping up with everything that they have in the city, especially since we're part of the BJC medical group and the BJC hospital system. We get a lot of their different imaging technologies out here. We also have a lot of access to surgical instruments and things that smaller hospitals don't always get access to, but since we're part of the bigger group, we do have those available.